Hi guys, welcome back to my channel, PA Study Buddy. In today's video we will cover another 50 high yield fast memory recall questions for PANCE. But before we get there, once again, congratulations, you made it this far. That is just amazing. Can you believe it? You made it through the PA school. That is just awesome. So for PANCE, you're gonna get ready, you're gonna do fine. My mantra was thousands and thousands of people have passed it before me, so can I. I'm gonna get prepared the best way I can. I'm gonna study and I'm gonna do fine. And these are kind of questions I studied. I would cover PANCE Prep Pearls for all the blueprint. I would hit the brush review for any questions, length, and I will post a separate video on how I studied for PANCE. And before I went to take my exam. I felt completely comfortable and I had no issues with the duration, and I will cover all that in the how to take a PANCE exam video. But in today's video, we'll cover these 50 questions, and here we go. The question number one, intentionally faking a disorder to assume the sick role without incentive is called what? So they're going to give you a stem of the patient that is assuming to be sick, but there's no incentive to be sick. He's not trying to get money or anything. So this disorder is called what? Factitious disorder. Also, for those of you that are back to my channel, thank you for supporting me. For those of you that are new, take a look around, see other helpful videos, hit that like button, make a comment. It helps my algorithm, and please go ahead and subscribe. Thank you. Question number two. Intentionally faking or grossly exaggerating symptoms for an obvious incentive. So remember, the first fictitious disorder, they didn't want money, they just want to be sick, but these people are actually malingering. Question number three. Personality disorders cluster A, name them. So the question may tell you that it's personality cluster A, or may give you signs and symptoms, but you should know what are the cluster A disorders, and those are schizoid, schizotypal, and paranoid. So here's a nice little chart that separates all three: cluster A, cluster B, and cluster C. Cluster A, paranoid, schizoid, schizotypal; B, antisocial, narcissistic, histrionic, borderline; and cluster C, obsessive compulsive, avoidant, and dependent. Question number four. This patient, they'll describe him as a loner, detached, if somebody who's going to have a flat affect, restricted emotions, generally indifferent to interpersonal relationship outside immediate family, a little interest in sexual activity. This describes what kind of disorder? This describes a schizoid disorder. So they're going to tell you a patient is a loner. They may tell you he's like a night guard, or works from home, doesn't like really communicate with anybody besides his family, has a little interest in sexual activity, no interest in relationship with other people, just likes to be by himself. So that is a schizoid disorder. Which criteria is used for acute rheumatic fever? So you're gonna have a stem where you're gonna diagnose acute rheumatic fever, but in order to diagnose somebody with acute rheumatic fever, you're gonna need to be utilizing which criteria, and that criteria is the Jones criteria. There's major criteria and minor criteria. So to diagnose somebody with rheumatic fever, there needs to be a presence of two major criteria, or one major and two minor. 6. What is the most serious complication of a Kawasaki disease? So in our prior video, we talked about Kawasaki disease. We talked about this as young children, likely Asians, less than 5 years of age, and the fever will be lasting greater than 5 days. So the most serious complication of Kawasaki disease is coronary artery aneurysm. So the stem will tell you everything about how this kid's been sick for greater than 5 days. You're going to figure out this is a Kawasaki disease, and they may ask you what is the most likely serious complication, and your answer should be coronary artery aneurysm. Genetic cardiomyopathy caused by mutation of the cardiac sarcomere is called what? That is hypertrophic cardiomyopathy. HOCM is characterized by which hypertrophy? Left ventricular hypertrophy. Left ventricular hypertrophy. So it talks about left ventricular hypertrophy seen on an echo, your differential diagnosis should include a hypertrophic cardiomyopathy. And if they're talking about a young athlete that collapsed on a field, that is definitely hypertrophic cardiomyopathy. What is hypertrophic cardiomyopathy's inheritance pattern? That would be autosomal dominant. Autosomal dominant. So the way I remember this is Holcomb drives A dominant auto. So dominant for dominant and autosomal auto car. Holcomb drives A dominant auto. Autosomal dominant. Kawasaki treatment. This would be IVIG and aspirin. So once again, they'll give you a stem with a young kid, and they'll ask you without even telling you that the Kawasaki, but you're gonna figure that out. And they may likely ask you what is the treatment, and they may give you IVIG as a A, aspirin as a B, and could be IVIG and aspirin as A plus B, but nevertheless IVIG and aspirin. What is the most common cancer amongst the 15 to 19 years old patient population? So you're going to talk about teens, and you're going to talk about different cancers that affect this patient population, but you should know the most common cancer amongst this patient population is Hodgkin's lymphoma. What is the Cushing's syndrome? Cushing's syndrome is excessive cortisol production. So we talk about they're going to give you labs, you're going to see the cortisol is super high, they're going to give you a stem about patient's other symptoms, and they're going to ask you what is this syndrome, and you should know that is a Cushing syndrome. What is Fitzhugh-Curtis syndrome? That is perihepatic gonorrhea infection, perihepatic adhesions. HIT syndrome often results in, so they're going to talk to you about the lab work. You're going to find out that this is the HIT, not DIC, and they're going to ask you what is often a result of this syndrome, and it is a loss of limb or life. That's why it's an emergency and it should be treated emergently. Reed-Sternberg cells should make you think of what? So the question tells you about the lab work they've done, and they mention that there's Reed-Sternberg cells, and that should immediately make you think of Hodgkin's lymphoma. The way I remember this is, have you read about Hodgkin's? Reed as Reed-Sternberg, and I say, they say Reed cells. I'm like, have you read about Hodgkin's? Look for Hodgkin's for your answer. What is Leriche syndrome? Leriche's syndrome. That is a claudication of the buttocks and thighs, impotence, atrophy of the legs, seen with an iliac occlusive disease. So they're going to tell you this patient has Leriche syndrome. They may give you a couple of these, say the patient has reported impotence, has an atrophy of the legs, and what other condition, and you should look for claudications of the buttocks and thighs for your answer. And they may also ask you what is it also seen with, and that would be iliac occlusive disease. What is Mendelssohn's syndrome? Mendelssohn's syndrome is a chemical pneumonitis after aspiration of the gastric contents. What is Mirizi's syndrome? Mirizi's, that's such a cool name. That is extrinsic obstruction of the common hepatic bile duct from a gallstone in a gallbladder or a cystic duct. So they're going to tell you or show you an image, and you're going to see there's an obstruction of the common hepatic bile duct, and they may ask you what is the name of the syndrome, and you should know that is Mirizi's syndrome. What is red reaction syndrome? So we talk about internal medicine, and they're going to tell you saw a patient, let's say in the ICU, and they were administered medication, and they became super red, and you should know which medication caused it and what is a red reaction syndrome. And the syndrome is because of the rapid vancomycin infusion, something we always see in the ICU here and there. It's kind of scary, happens fast, and it results in a skin erythema, and you treat it by stopping vancomycin immediately. What do electrolytes look like in a refeeding syndrome? So they're going to tell you a patient was found down, malnourished, something, and They're worried about refeeding syndrome, and they're going to give you a list of electrolytes, and they're going to ask you to say this is the most likely findings you will see on a blood gas or other labs, that whatever. But for electrolytes, all three of them will be down. That's all you have to remember. Refeeding syndrome, they're super hungry, they're gonna start eating fast, and you're gonna be worried because their electrolytes are all gonna be down. Hypokalemia, hypomagnesemia, and hypophosphatemia after refeeding a starved patient. What is the short gut syndrome? Short gut syndrome is malnutrition resulting from less than 200 centimeters of visible small bowel. So they may give you an image and talk about this is a very short, small bowel, less than 200 centimeters, and they may ask you what is the most likely syndrome, and you're going to say short gut. What is Trousseau syndrome? What is Trousseau syndrome? That is a syndrome of deep venous thrombosis, DVT, associated with carcinoma. So the best way to see DVTs is Doppler ultrasound. They're going to tell you, the patient had a Doppler to show a DVT. They may also tell you the patient has a history of the cancer, and they may ask you what is this, they suffer from which syndrome, and your answer is Trousseau syndrome. So DVT plus cancer, Trousseau syndrome. How long will it take troponin to return to normal? Troponin will return to normal in 7 to 10 days. When does the troponin peak? Troponin peaks in 12 to 24 hours. When does the CKMB peak? Also 12 to 24 hours, just like troponin. When does the CKMB return to normal? In 3 to 4 days. ST depressions or T-wave inversions should make you think of what? They should make you think of NSTEMI or unstable angina. So you may get an EKG that shows ST depressions or T-wave inversions. Your next thought should be to look at the troponin to differentiate between NSTEMI or unstable angina, because the NSTEMI will also have increased troponins where unstable angina will not. That's the easiest way to separate these two. How would STEMI show an EKG? ST elevations greater than 1 millimeter in 2 or more contiguous leads. And you can see the line is right there, and this is greater than 1 millimeter, each one of these. So you're going to see it in 2 leads. This is V3, they may have it in V4 as well. So greater than 1 millimeter, ST elevations in 2 or more contiguous leads should make you think STEMI. Which patient population will commonly present with a silent MI? So they're going to tell you the patient has suffered an MI but had no symptoms, and what is the likely population? This would be females, elderly people, and diabetic patients. All these patients can present with a silent MI. Incompetent cervix is a cause of spontaneous abortion in which trimester? So they may give you a stem which describes an incompetent cervix, and they may ask you in which trimester this would cause a spontaneous abortion, and that would be the second trimester. What medication is used in the emergency contraception pill? So they're going to tell you the patient is taking emergency contraception pills. They may even give you side effects or ask you for side effects. But the most common medication used in emergency contraception pills is levonorgestrel. I just remember it as levonorgestrel. Levo. It's easier. When is the luteal phase of the menstrual cycle? It is days 15 to 28. Name some contraindications to the OCP use. So they may give you a stem in which patients asking for OCPs, they will give you patients' age, they may give you comorbidities and ask you what are the contraindications, and you should know that the OCP should not be used in females greater than 35 years of age who are smokers. Patients with a history of blood clots, breast cancer, or migraines with aura. So every one of these could be an answer on that question. So knowing these fast memory recall questions and Super important tip is, guys, when you read a question, you can practice this with Rosh or with any other platform used to practice long stem questions. My advice is to read the last sentence first of the stem. So the last sentence will ask you what they're actually asking you in a question. So it could be, what's the next best step? What's the most common? What's the side effect? Then glance at the answers, and at that point start reading your question. And I'm sure by the end, like 2, 3 sentences, you should be close to being able to give the correct answer. Which OCP is safe in lactation, can be used in breastfeeding women? Those are the mini pills, progestin only. Inflammation of the glans penis is called what? That is balanitis. Balanitis. What is the most common cause of balanitis? Candida albicans. Candida albicans is the most common cause of balanitis. Most common cause of Lyme disease. Most common cause of Lyme disease is Borrelia burgdorferi. That is a funky name. Burgdorferi. That is, it is spread by the deer tick. So Lyme disease, deer tick, Borrelia, BB, Borrelia burgdorferi, deer tick. Narrow QRS means, so they may show an EKG with a very narrow QRS that should immediately make you think of tachycardia. And tachycardia is heart rate greater than 100. Widening of the mediastinum is seen with what condition or disorder or problem? So they're going to tell you the mediastinum, widening of the mediastinum was seen in a report on chest X-ray that should make you think of the aortic dissection. Estrogenic side effects. What are the side effects of the estrogen? Bloating, nausea, vomiting, breast fullness, breakthrough bleeding, irritability, headache, and hypertension. Once again, bloating, nausea, vomiting, breast fullness, breakthrough bleeding, irritability, headache, and hypertension. Name a progestin-only IUD. Which IUD is a progestin-only? That would be Mirena. Emergency contraception time frame. What is the time frame for emergency contraception? Within 3 days of unprotected sex, or prescribe Ella within 5 days. Plan B within 3 days, or Ella within 5 days. And continue with emergency contraceptives. Consider also copper IUD within 5 days if the woman also wants a long-lasting contraception. Is the most common effective emergency contraception. So they may trick the stem by saying the young patient comes in, it's, they had unprotected sex, they don't want the kid, they look for something, and if there's no mention of the long-lasting contraception, then you can think about Plan B or Ella. But if the patient also says they would also like some long-lasting contraception, then you should be thinking copper IUD. High FSH and low testosterone should make you think of what? High FSH and a low testosterone. That should make you think of the primary hypogonadism. Low testosterone, high FSH, primary hypogonadism. Which medications may help lower anti-sperm antibodies? Corticosteroids help lower anti-sperm antibodies. What hormone would be the most definitive in diagnosing menopause in a 54-year-old female with amenorrhea? So they're going to give you a stem that says this is a 54-year-old female with amenorrhea, and they're going to give you some other blah 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 stem, and then they're going to ask you what hormone would be the most definitive to diagnose menopause in this patient. And your answer is FSH level greater than 30. Carpal tunnel syndrome will involve which nerve? So they're going to give you a stem, they're going to describe a carpal tunnel syndrome, and they're going to ask you which nerve is most likely affected, and that would be the median nerve. Thoracic aortic dissection can be due to what? It can be due to the prolonged hypertension and smoking. What is the aortic dissection presentation? Tearing pain, ripping pain radiating to the back, plus severe distress and diaphoresis. They're going to describe a patient that comes to the ER and they're going to say they have this tearing chest pain that's radiating through my back and they're going to be in severe distress and diaphoresis, and you should be thinking aortic dissection as your final answer. For non-cardiac surgery patients, ejection fraction must be at what level? Greater than 35%. So you're going to look at echo, you're going to look at the left ventricle ejection fraction, and if it's greater than 35, then they're okay to have surgery. And the final 50th question, derm question, open comedones are what? They're blackheads. Closed are whiteheads. Well, thank you guys. This brings us to the end of this video. I hope you like it. I hope these kind of questions help you out. I will strongly advise you to check out my video on how I take the test, how I go through the questions, how it saves me time. I'm going to make another video on how to study for PANCE, but definitely look at that video on the test taking strategies. There's also a radiology video, which will be super helpful for your PANCE. But once again, congrats. You're going to do fine. Go ahead and subscribe to my channel. Help me grow. Please leave a comment and tell me what you think about these videos. Should I wait before I give an answer, or is this okay pace? Any feedback will be greatly appreciated. Thank you guys. Good luck. You're going to do great.